I've seen this place for years, but I never knew what it was.
Well, when we first came, I was scared. I was very scared.
He's learning, he's progressing, he is so happy.
What's best for my child? It's a question every parent asks all the time. And finding an answer is usually a routine part of everyday life. But if a child has special health care needs, getting an answer to that question takes on a whole new dimension. At the Cleveland Clinic Children's Hospital for Rehabilitation, we help families discover what's best, with comprehensive care, compassion, and commitment. Working together with their family, we help each child build on their existing strengths so that they can reach their fullest potential.
Kaylee had a brain injury and she was still in a coma, and that's why we came here. Kaylee has had speech, occupational, physical therapy, and recreational therapy. Everything goes around the children here. The way they get them to work, they play with the children. They must be having fun and enjoying their therapies.
We actually ended up coming to children's rehab because my daughter sustained a severe head injury and she was in a coma. And we knew she would need intense therapy. And these people were so caring and they were so concerned, and they went the extra mile. When you have this type of therapy that is geared toward children, it's beneficial.
My son's Kent, he's 10 now. He was diagnosed pretty early with autism at 22 months. Fortunately, we did hear that the Cleveland Clinic was opening up a center for autism. This kid is so smart, he has so much in him, but he has no means of expressing it. And that is when we knew that the Center for Autism was right for him.
Everybody that worked with Kaylee was involved. We had meetings every Thursday where the doctors were involved, the nurses were involved. Everybody had their say of what they felt, even we did. I mean, there's a few times they used our inputs to actually, further her progress.
That's one of the things that I loved a lot about this place was the team approach. They involved us in every aspect of her care. We had weekly meetings with all of her therapists, anybody who had any contact with Danielle, the teacher, the school teacher, the psychologist, even the nutrition people were involved, and like the nurses, Dr. Henry, all the doctors. They listened to me as her parent. I know I'm not a medical professional, but I am her mother.
The biggest impact is that the center has done for him is to get him a communication in place, and it is just excelled in all areas. I mean, he is just a happy little kid.
Beautiful job using your computer, Kent.
Well, there's unity, I would say, among the staff. They definitely worked with us. They definitely educated us on how to take care of Danielle. So they provided us with everything we needed and what we needed to know in her recovery.
Perfect, good job.
When we were ready to go home, we had to learn Kaylee's care 100%, me and my husband. They made sure that we knew how to feed her, how to give her medications, how to use all the equipment correctly. We had to be trained and it had to be checked off before we were allowed to take her home permanently.
I can't thank the center enough, the Cleveland Clinic. This is so needed. For him to independently communicate with us has been amazing. You can't ask for anything more than that.
Kaylee's doing great. She can walk now, she can talk, she can eat, she's regaining use of her arm. She even tries to run.
I wouldn't go anywhere else. It's a fantastic place. If you're gonna go someplace, it should be here.
The level of expertise as far as therapy is tops. I think the staff is great. I just think this place is phenomenal. I really do.
The rehab is a must. It definitely gives a child a jump start to the road to recovery. It's the best thing for your child. That's it. It's the best thing for your child.